Babesiosis by Ariel Butler. Babesiosis is an unusual, cruel, and sometimes fatal tick-borne disease caused by many types of Babesia, a protozoan, a tiny parasite that infects red blood cells. Most human cases of Babesia infection in the United States are caused by the parasite Babesia microti. Babesia microti life cycle involves two hosts, which includes a rodent, primarily the white-footed mouse, and a tick in the genus Exodus scapularis, which are called a deer tick or black-legged tick. Deer ticks undergo 4 stages of development: egg, larvae, nymph, and adult. They live 2 to 3 years and have 3 blood meals. Once to molt from larvae to nymph, once from nymph to adult, and once as adults to lay eggs. Larvae are tiny and feed only on birds or mice. Nymphs are about as big as a poppy seed, but like adults, will seek larger hosts, including deer, dogs, and humans. At this time, the nymph may transmit disease-causing organism, babesiosis, to humans or domestic mammals. Adult female mate on or off a host, then feed for several days, swelling to twice their normal size. Once engorged, they drop off, lay their eggs amid the leaves, and die. Babesiosis mainly occur in parts of the northeast and upper Midwest in a usual peak during the warm months. Deer ticks live in wooded, brushy areas and along trails and forests. Deer ticks reside on the tips of grass and live along these trails, allowing them to crawl directly onto the skin or fur of a passing host. Deer ticks feed on blood by inserting their mouth parts into the skin. On humans, deer ticks are commonly found in the areas near the nape of the neck or along the lower scalp. Babesiosis is more severe in elderly or in uncompromised individuals. Uncompromised individuals are people who have HIV or AIDS, are pregnant, or are undergoing chemotherapy or radiation therapy for cancer, and especially those who have had their spleen removed. Symptoms of babesiosis start with a high fever and chills. Sometimes babesiosis is often so mild it is not noticed. As infections proceed, patients may develop fatigue, headache, drenching sweats, muscle aches, nausea, and vomiting. You may notice a spreading bullseye rash from wherever the tick bite. Babesiosis can cause a special type of anemia called hemolytic anemia. This type of anemia can lead to jaundice and dark urine. Treatment for babesiosis is ectovaquine and azithromycin. Treatment can last for 10 to 2 months depending on how bad the disease is. The treatment is taken orally 3 times daily. People who do not have any symptoms or signs of babesiosis usually do not need to be treated. To prevent babesiosis, avoid contact with vegetation as much as possible. Wear light-colored long-sleeve shirts and long slacks. Apply repellent such as DEET to shoes, socks, and slacks. Make sure you tuck slacks into socks. While outdoors, stay close to the center of hiking trails. Also, try to keep your home lawn mowed. In addition, check pets daily and remove any ticks always with tweezers. To remove a tick from the skin, use the fine-tipped tweezers. If you do not have tweezers, put on gloves and use the tip of your fingers. Grab the tick to its mouth as you can. The body of the tick will be above your skin. Do not grab the tick around its bloated belly. You may push infected fluid from the tick into your body if you squeeze it. Gently pull the tick straight out until its mouth lets go of your skin. Do not twist the tick. This may separate the tick's head from its body and leave parts of its mouth in your skin. Put the tick in a dry jar or Ziploc bag and save it for later identification if necessary. Wash the area of the tick with a lot of warm water and soap. Mild dishwashing soap, such as Ivory, works well.